Welcome everyone. My name is Dr. Ahmed Larabi. I am a demonstrator of medical education at Faculty of Medicine, Mansoura University. Today we will explore an essential skill for medical educators, which is providing a constructive feedback. Feedback bridges the gap between current performance and desired outcomes, ensuring our learners develop both competence and confidence. And let's delve into its principles and best practices. Let's start with the definition of feedback. Feedback in clinical education refers to information describing a learner's performance in a specific activity. Its goal is to guide improvement in that same or a related activity. Unlike mere criticism or praise, feedback is structured, actionable, and targeted. It is a vital communication technique where educators provide learners with insights into their progress toward mastering skills or achieving course objectives. Now we are going to understand the importance of constructive feedback through this case example. Let us consider this scenario. A junior doctor performs a central line insertion in the ICU, but the placement is incorrect, risking patient complications. After the procedure, the senior doctor says, "That was unacceptable. You almost caused harm." Now let us compare this with this response. "You were cautious with the sterile technique, but missed the correct insertion point. Next time, focus on positioning and ultrasound use, and let's practice this together." The first response is demoralizing and unproductive, while the second approach highlights strengths, identifies errors, and provides a clear pathway for improvement. This is the essence of constructive feedback. Now let us talk about the characteristics of constructive feedback. Constructive feedback is characterized by the following principles. 1. To be descriptive rather than evaluative. Focus on specific behaviors rather than making judgments. For example, you thoroughly gathered the patient's history, but missed some cardiovascular risk factors like smoking, but avoid saying you are weak at taking patient histories. 2. To be specific rather than general. Pinpoint the exact behavior needing improvement. For instance, you did well in identifying symptoms but missed asking about family history. But avoid vague comments like, "You need to improve your history-taking skills." Number 3, to be action-oriented or action-focused rather than behavior-focused. To address what the learner did or did not do without making it personally. For example, "I observed that you didn't wash your hands before examining the patient, which could impact infection control." But avoid saying you don't care about hygiene. 4. Two-way exchange information. Foster dialogue by encouraging reflection and mutual understanding. For example, "What do you think about how you handled the patient with chest pain? How could the time spent on investigations have been managed better?" These are important tips for giving constructive feedback to be considered, in addition to the characteristics that we have talked about. To deliver feedback effectively, keep these tips in mind. 1. Plan in advance. Structure your feedback to ensure clarity and relevance. 2. Be prompt to deliver feedback soon after the event for maximum impact. 3. Provide feedback privately. A one-on-one setting creates a safe environment for learning. 4. Start with the strengths. Begin with what the learner did well before addressing areas of improvement. 5. Encourage self-reflection. Ask open-ended questions to help learners assess their own performance. 6. Be mindful of nonverbal cues. Your tone, posture, and expressions matter as much as your words. 7. Document key points. Writing down essential feedback helps track progress and provides a reference for future sessions. There are also tips for receiving feedback. The feedback receiver should embrace the feedback session as a learning opportunity. Receiving feedback is just as important as giving it. 1. Listen actively. Avoid interruptions and focus on understanding the feedback. 2. Ask for clarification. Encourage questions to ensure the feedback is clear. 3. Pause and reflect. Take time to process the feedback before responding. 4. Stay positive. View feedback as an opportunity for growth rather than criticism. 5. Show appreciation. Acknowledge the effort and insights provided by the feedback giver. 6. Act on feedback. Proactively apply suggestions to improve performance. In conclusion, feedback is a powerful tool that shapes professional growth and improves patient care. By providing feedback that is constructive, specific, and actionable, we create an environment where learners feel supported and motivated to excel. Let's commit to mastering this vital skill, ensuring we guide our learners towards becoming confident, competent healthcare professionals. Thank you everyone for listening to this instructional video.